Thank you, Professor Kongfarm. I find the story of Vietnam at the same time extremely inspiring and extremely depressing. So extremely inspiring because this miracle happened of helmet use. And we really, really wish we could do this everywhere. And then this business of mortality not improving, we have to somehow come to terms with this and try and understand what it means for us as a road safety community. I hope that will be a part of our discussion when we do the question and answers. Next, I'd like to invite Professor Shailaja Tetali. She's a assistant professor at the Indian Institute of Public Health in Hyderabad, India. Shailaja.
Thank you, Kavi, for the introduction and for calling me professor. Really feels good. It's an honor to be here, and I would like to thank Professor Haider for inviting me here. Social and behavioral factors are very difficult because they're difficult in the sense that they're very difficult for a person to change the social and behavioral aspects in terms of the risk factors for injuries, especially road traffic injuries. You all might know that it's very difficult to change behaviors, and we have found this in various aspects of public health, including HIV, etc. So I'm going to speak about the social and behavioral factors, and the contents of my slides are from two sources. One from literature searches and what is based on the evidence. Second, from my own experience as a road user. Because social and behavioral factors are very important in the way road users make their choices and decisions when they're on the road. And I'll try to speak a little bit on that. So the presentation will flow like this. I've used a lot of pictures, one, because it'll give a good perspective, and also because it's easier to tell a story with pictures. I'm going to speak about the layers of factors, especially the social and behavioral factors in road traffic injuries. And I'll speak about some more details on the factors. It's mainly from an Indian perspective, from an Indian lens, mainly because I live there, and I've not lived in any other LMIC country. And lastly, I'll conclude with some points to think about, not on how to design appropriate interventions, but what points we need to think about when such interventions are designed, especially with an LMIC perspective. So this is a typical day in Hyderabad. I come from South India, and as you can see, this is my way to work. And you can see that there's hardly any scope for pedestrians to walk on the sides of the street, although this picture doesn't show the sides of the street, but there's hardly any space for any pedestrians to move around. It's mainly vehicular based. Other people going to their places of work. The picture on the left shows a woman who is carrying something on her head. And this picture is taken right outside the place where I live. On the left side is the gate of my apartment complex where I live. And this is a fairly wide road. It's very difficult to cross that road, mainly because the speeds of vehicles is higher than it is usually in the center of the city. So I'm sure at some point of time, this lady would want to cross across the street, and she would perhaps run, spilling some of her things which are on her head. The picture on the right shows fairly congested part of the city, and there are many parts of the city which are like this. You might notice that this has a sidewalk, and it's one of the few places in Hyderabad which has a sidewalk or the pavement on the right side. And since the rush hour has just begun, and it'll only get more and more crowded, you'll see after some time some of these two-wheelers on the right side going onto the pavement. So it's very difficult for anybody else to be on the pavement, including the pedestrians. Another person perhaps taking mattresses, that's what I guessed. I could take this picture from close range, but I'm guessing that these are mattresses that person will deliver to a place where they will be sold. And you can see that there's a lot of mixed traffic on the roads, so you have non-motorized as well as motorized vehicles. Another person trying to sell his chairs. And so there are lots of compulsions, economic compulsions, where people have to sell their wares and make some money by the end of the day. And again, this picture shows a mix of traffic, non-motorized as well as motorized travel. Thanks to my friend JK for this beautiful picture. This is a family on a three-wheeler, and they're taking all the vegetables from one place to another, and they will sell it by the end of the day. The point I would like to highlight is that if there is a sudden break, half of them will fall down and get injured. They look very happy now, but that may not be the case if there is an injury. This picture, again, the streets of Hyderabad. On the left, it shows that there's very little space for pedestrians to walk because the infrastructure is poor. So they spill over onto the street, and that is where they end up walking. And there are lots of electric poles with wires hanging also, which is another kind of danger. On the right, you can see some waterlogging and ditches that have been dug by the municipality for various drains and other work that needs to be completed. The problem with that is that when there are rains, those ditches get filled. And when there's poor lighting or no lighting at all, there's a danger of somebody falling in there, including animals and human beings. More pictures of the city when there are rains. There's a lot of waterlogging. The other problem we face is there are these open drain holes, and there have been cases where people have been walking on the street and suddenly get pulled into one of those drain holes, and then it's a very deep, several feet long, deep hole, and then they get pulled into the drainage system, and it's almost instant death. And there have been several cases like that. It happens every monsoon. Whenever it happens, there's reports in the newspaper, and then after that, life goes on. So nothing much is done in terms of prevention for such kind of injuries. This shows that there is a divider in the middle of a crowded street, and I would like to highlight that the little space that is available in the middle is used by vehicles as well as pedestrians to cross, and they have to cross very quickly. More pictures of pedestrians trying to get over the median that's there in the middle, and these medians run across the middle of the street on most places. So pedestrians have to jump over those medians and sometimes also wait in the middle. And there's very little space. It's like tightrope walking, the picture on the right side. So people just wait there, and then there's a continuous stream of vehicles. There's hardly any let go. So at some point, they decide to jump and run across the street. Very dangerous, but it happens all the time. More pictures of pedestrians crossing. This is a very typical scene in Hyderabad. So they just have to weave in and out of traffic. And if there is a critical mass of people, that's when they jump across, because that's when vehicles take notice. And vehicles don't stop, they only come to a rolling. They just slow down and let these people pass in. Fortunately, the speeds are low. So that's what we're banking on in terms of crashes and injuries. We have very high rates, but in terms of deaths, they're low. There is a foot-over bridge, but people still run across. So these are this is where the behavioral factors come in. You know, there might be reasons for this kind of behavior, why they want to jump across the road instead of climbing 20 stairs on one side, going across and then climbing down the 20 stairs. And also the advertisements that are there in the middle on the foot-over bridge make it unsafe in the nights, so people avoid that and then jump across the street. Risky behaviors that certain groups undertake: children, underage driving, no licenses perhaps, and many people on the motorcycle. Then there is a picture of a family of 6 on the top right. Perhaps because of compulsions, there's no assured public transport, and there's a compulsion of getting somewhere in time. And it is difficult for that person perhaps to own a safer mode of transport, a car or something else. So that's why on the motorcycle. The picture on the right bottom is some youth who have figured out that there is a policeman there trying to give tickets for lack of helmet. So they're trying to make a quick U-turn and run away from there. But you can see that they're very happy that they've avoided the fine. So pictures are over now. I'll get on to the main stuff. So this is a picture that, a diagram that I have constructed with various factors that I think are important in road traffic injury determinants. And the one that's innermost is the individual factors, who we are as human beings and how we behave. And that is, of course, influenced by our family. That is influenced by the society around us, what the social, political environment is around us, and more macro-level factors. So this is how I'll speak on in terms of the factors or the determinants, the social and behavioral aspects of road traffic injuries. I would like to point out here, but that the onion rings that we have, the layers, they're porous. So the individual factors are affected by the factors around that, also the macro level factors. So they play around through those porosity. The layer one, the individual factors depend on age. We know that certain age groups are more prone to road traffic injuries, and the typical group is 15 to 44 or a little more. And gender has a role. It's a determinant. More males get injured. Also, perhaps there are more males on the streets. Education, income, these are all factors or determinants that lead to injuries. It's been shown that high level of income and high level of education is actually a protective factor, but it's not that clear because there are confounders. Education is confounded by income, etc. Marital status, it's been shown that people who are single perhaps take more risks, and those who are married have safer records for injury. But again, that could be confounded by age. So some people tend to take risky behaviors. We don't know why, but they're different human beings, and then they have different levels of acceptance of risk, perhaps. There are economic compulsions that I talked about, especially the taxi drivers and also the pizza delivery people who are on two-wheelers and have to make multiple trips because they have to pay off the rent for their vehicle at the end of the day. So there are economic compulsions. Knowledge of traffic rules. I assume that everybody knows traffic rules. But when we did some interviews in Hyderabad, we found that there are many people who do not know that they have to go all the way to the end or the middle of the street and then take a U-turn. We assume that they know about the traffic rules, but they said, it's right here, why should I make that U-turn? Why should I drive that extra distance? I'll just turn around, turn my vehicle and then cross here. So there is a lack of knowledge in some cases. Practices and behavior towards helmet use, towards drink driving, and the value we as individuals place on safety of self and others, all these play as determinants of road traffic injuries. Now coming to the next level, that is the family level factors. So I feel that families influence, for example, the father and the mother might influence their children or their immediate relatives on safety and value that they place on their safety as well as the others. Practices with respect to bribery, especially in countries like India, they don't have any qualms in paying the policeman a little bit of money and moving on. So they don't think that anything is wrong with that. And the question of traffic culture itself, or traffic safety culture in the family and in the society, that also plays a huge role as a determinant in road traffic injuries. Many people think that it's okay to go in any direction they want because they want to get their work done. Also, the question of competition in India, especially with 1 billion+ people, everybody wants to get somewhere first. And And nobody can be, I mean, not all billion people can be first in everything. So they just want to rush somewhere and then climb over vehicles and then get to their place and practically do nothing after that. So they want to get to their offices quickly, but not work. So that's a traffic safety culture that I've found, especially in India. All this experience is from living in India. The last point, very important about destiny, the feelings that we have, especially in Indian culture, about the fatalistic attitude that nothing can be done. If it is written in the book of fate that you're going to die at a certain point or a certain time, there's nothing that you can do to change it. No safety precaution, no nothing. You're destined to die, that will happen. So, and in interviews, we have found that this has been reinforced. We found that in certain places, when we did interviews, people said that at this junction in Hyderabad, there is this goddess who is thirsty for blood, and it's very likely that somebody will get injured at this junction. But of course, that's not true. That's because there are lots of blind spots in that particular junction, or the infrastructure is poor, or something like that. But a lot of weight is given to destiny in our culture. The societal factors, moving on to the layer 3, the cultural factors that are there. Certain groups might have, I don't know, lower skills or higher skills in weaving through traffic. And we saw the bunch of children on the two-wheelers sometime back in the pictures. They might have risk-taking behavior in certain groups. And there's also this mob behavior. I have seen in Hyderabad where there are 4 people on the motorcycle, and if a cop stops them, they haggle with the cop and then they speed away. But before speeding away, they hit the cop and then run away. I've seen this personally with my eyes. So there's also this culture of mob behavior, which is not good at all, but it also leads to more injuries. The perception of risk of getting caught, very important. But somehow Indians feel that the risk of getting caught is very less, so they go on violating the traffic rules. And they also have the tendency of haggling with the police, and they have a sense of entitlement where they don't want to be caught, first of all, when they break rules. Or if they get caught, they want to go away with very little fine or no fine at all. Okay? So, and the last point is social rehabilitation is rather poor in our country. So if a person is disabled, the family takes care of that person, but we don't have the larger formal structures in society to take care of a person. The extent of the media, influence of media is huge. So when there is a crash involving a celebrity, there are lots of reports in the newspaper, but after that it dies down. It's not consistent. And the tolerance to risky behavior is very, very high in our society. So we have large number of fake driving licenses, and the typical discussion among college students is that, hey, I got a license, says one person, and then the other person says, how much did you pay? And how long did it take? So if you've paid the least amount of money and you've got the license in under a week, you are smart. So the tolerance to such behavior is very, very high. The traffic culture of the people, I've talked about this in the past. And the point I would like to highlight is very difficult in our society to give way to an ambulance, even if there's space. Most of the time, the roads are so crowded that there is no place for the ambulance to move. That's a different situation. But even if it's a wider road, we just don't care about an ambulance, and we don't give way. That's another thing that hopefully will change. But all these these are social and behavioral factors especially, which are very difficult to change. Drink driving is another area that's catching up. It's more socially acceptable to drink and drive in India, and that's going to be a bigger problem every day, especially in the weekends now. Layer 4, the political environmental factors. All these are important when it comes to the social and behavioral factors in road traffic injuries in LMICs. What is the political will? What is the governance structure? What are the administrative processes? Is it difficult to find a driver's license, to get one? Or is it easy through bribing? All these have a bearing on road traffic injuries in that area. The roads the rules and regulations and the level of enforcement. Even if we have rules, if it is not enforced, then we have a problem. The level of corruption especially in giving tickets and taking bribes, etc., that I've talked about. We do not have, or we have very poor insurance mechanisms in the country, especially for disability or unemployment insurance or due to disability, and social benefits, etc., are poor. So the cost of a road traffic injury in our country is huge, especially if a person who is injured belongs to the lower socioeconomic status. The importance given to scientific research is also very less. So if there are any results and then they have to be put into action and then evaluated, that's still at a very low level when it comes to government bodies. Coming to the last layer, that is the macroeconomic factors. These are true for most countries. What is the level of internal peace in that country? What is the law and order situation in that country? Has a bearing on the kind of injuries that we have. And if it's a country like India, where the economic growth has been very rapid, it has a bearing on injuries. Adult literacy rate, income, unemployment rate, all these have been shown in the literature to have a bearing on road traffic injuries. The population structure and the population density too. So if you have more number of young adult population like it is in our country, then we have more number of road traffic injuries. Urbanization, of course, it is also linked to motorization. The land use pattern, very common nowadays in India to see highways going through villages, but the villages still, the relatives want to talk to each other. So they jump across an 8-lane highway, meet their relative and come back, putting them at risk. But this is how the land use pattern has been in India of late, of the last few years. Motorization, I talked about this, the number of vehicles per kilometer of road. When that is high, then the speeds are, of course, lower, but the risk of injury it could increase or decrease depending on the kind of mix of vehicles that we have on the road. What kind of organization of transport do we have? What choices are available to the people? Do we have safe, affordable transport? What is the mix of traffic on the street? A road density network has, again, a huge role to play in road traffic injuries. Transport management and calming mechanisms that we have in a city or in the rural areas, that's a determinant as well. And the quality of road infrastructure, potholes, lack of pedestrian crossings that we saw in the pictures have a bearing on road traffic injuries. The visibility on the road, pedestrian crossings, the number of pedestrian crossings, all these affect road traffic injuries. All these have been shown as determinants in the literature, and I just pulled that out. Average speeds, we know that as speed increases, the road traffic injuries and crashes go up exponentially. Number of police, their pay and motivation. The average pay for policemen in India is something like $100, so their motivation also could be very low. Prevalence of drink driving, it's increasing in India and also increasing the road traffic crashes and also perhaps deaths due to alcohol. Roadside sale of alcohol, we have many joints along. So we have a drink driving enforcement drive conducted by the police. Right next to it are the alcohol outlet. So it's very hard to influence policy in these things, so uphill battle, but it has to be fought at some point. And the last point on availability and speed of emergency medical services also has a bearing on road traffic injuries. I would like to summarize that these are all the factors that are determinants of road traffic injuries in low and middle income countries. Quickly move on to points to think about while designing interventions. The interventions that work in high income countries may not work in low income countries. So if you have a traffic calming mechanism that works in Europe, the roundabouts, for example, they just don't work in India. We have roundabouts in India, in the city that I live in, but it's chaos. You have a huge circle and everybody wants to get there and run around there. So a traffic light would be better there. So we cannot simply import the interventions that work in high income countries. We should concentrate on motorcyclists, bicyclists, pedestrians, etc., who are the vulnerable groups. And we have to be aware of the existence of inequalities. social justice, like it was pointed out this morning, and we have to pay attention to the risk distribution by the socioeconomic group. So widening the roads to improve road safety will not work. And it is better to reduce the width of roads, width of lanes. It's better to make a one-way street, a two-way street, because the speeds will reduce. And we have to pay attention to the design of bus stops, because people get off the bus stops and their psyche is to immediately cross the street instead of walking somewhere and then taking the foot-over bridge. The last slide, I couldn't have put it better, so I just took some words out of a report. It says that if some areas have high injuries, then we have to do a targeted intervention to such areas. But if it is a systematic difference in the risk of injuries, and it's merely a reflection of a wider web of causation where you have risk differentials because of the differences in the way people live or their income, etc., it has to be more holistic. And the response would have to be at a societal level and not at an individual level. That is all I have, I think. Thank you so much for the references.